Health Leads is a nonprofit organization committed to addressing the basic resource needs of patients and clients. And so what we consider the family help desk is the area in the clinic or the hospital where a family member can come and to tell us what their basic needs are and where we work to help them meet those resource needs. Depending on what the client identifies as a really important need for them, we provide things such as food pantry information or a food bank where they can visit to get food if they don't have enough food to last them until the end of the month. Other things such as utility assistance, housing assistance, emergency shelter, childcare, education enrollments for young children, as well as seasonal resources such as summer camps or toys for tots. Anything that the client is looking for, we will assist them in getting those needs. The most common way that families come to our desk is they visit their primary care physician. During the visit, the provider will screen for basic needs. And in conversation with the client, they will determine what those needs are, identify them, and then refer them to the family help desk or to Health Leads. So the patient could come to the desk, speak to what we call an advocate or an ambassador, someone who will work with them to meet their resource need. That advocate will then tap into the resource landscape that we have or the database that we have to appropriately identify the need as well as meet the need. So connecting them to a resource that's in the area that they live or which they frequent so that they can have that resource need met. Once they identify the needs, we reach out to the community organizations who address those needs, and then there's some follow-up that happens after that. So the patient will be called or contacted by the advocate to determine if they were successful in submitting their application for health insurance, or if they were successful in getting the food at the food pantry that we referred them to. Following that, we as the advocate or Health Lead staff will communicate back to the clinical provider what's happened with that client. So there is some closing of the loop there. We have a very unique opportunity in a diverse workforce. We primarily work with college students who actually sit at the desk and do the work. So it's a different feel because college students are energetic. They're eager to help. A lot of the students that we have are returners, which means that they come back semester after semester or year after year. And so a lot of the feedback that we get is very positive, that they really enjoy. They have a passion for working with families and with people and want to see some success. They want to change the healthcare system, which is one of Health Lead's goals, to promote some leadership and to change what healthcare really looks like and the quality of it. Since 2010, Health Leads has seen over 23,000 patients. We're having a huge impact on the families that we serve. Some of them come back because they know that this is a safe place to share. They know that they're going to get the help that they need. There's an impact on patients, but there's also an impact on the providers. So supporting them to be able to provide comprehensive health care to their patients is another impact that we're having. At the end of the day, it's really about being successful at that connection, making sure that the patient got what they needed when they came in the door.